So now you have this new, approach to health that is driven not because not because of altruism, like let's solve the problems of the world, but it's driven by kind of self-interest, saying that maybe we have to solve their problem because their problem may soon become our problems.
Hello and welcome to the Global Health Unfiltered podcast, a podcast about untold stories and realities in Africa and the world. Thank you for joining us for this episode. I'm Orik Sidney Kamunye, and I'm joined by my co-host Desmond Jumbam. Hello, Desmond.
Hey, Ulrich.
This is the first episode of a 6 episode series that we'll be realizing once a month for the next 6 months. This special series is thankfully supported by the Promoting Decolonization Using Innovative Knowledge Practices grant hosted by the Center for Tropical Medicine and Global Health of Oxford University's Nuffield Department of Medicine. So in these 6 episodes, we will showcase the contributions of 6 African global health leaders. First guest in this series is Raoul Kamadjeu, a physician, co-founder, and managing editor of the Pan-African Medical Journal. He is driven in all his projects by a simple motto: start small, but think big. He got his doctorate in medicine in Cameroon and completed his MPH in Belgium at Université Libre de Bruxelles. He experienced a broad spectrum of public health practice from the district in Cameroon to international arenas with the World Health Organization, the US Centers for Disease Control and Prevention. He's worked with the CDC from 2004 to 2006 as a Public Health Informatics Fellow, and from 2007 to 2014 as a medical epidemiologist. He currently works with UNICEF at the headquarters, working with the Public Health Emergencies team, and he is a PhD candidate in epidemiology with the City University of New York, at the Graduate School of Public Health there and Health Policy. His expertise spans across fields, as you've guessed, as wide as epidemiology, biostatistics, informatics, communication, computer programming, and project management. So, welcome and thank you for joining today's episode, Dr. Kamadjeu.
Thank you, gentlemen, for having me. I appreciate.
Yes, thank you for joining us today. So, you have extensive experience as a medical doctor, as an epidemiologist, a journal editor, and now a PhD candidate. So, the first thing we would like to know is uh, your journey. So, what has been driving your journey throughout the years?
I don't know. Maybe just the will to learn new things, the will to just experience different things. I started in Cameroon, as you put it, and I was a district medical officer. So these were quite interesting experiencing. In med school, we don't learn about public health much. So I discovered public health when I was working as the district medical officer. Understanding that you can have a broader impact when you work with communities than just sitting in a hospital waiting for patients to come. So that's how I discovered public health, and I decided, oh, maybe this is something I should do. And I remember this quote of someone saying that good doctors are so good that they prevent the disease from ever happening, and bad doctors, they have a lot of patients at their doorstep and just treating and treating and treating. So I like learning. I'm just always learning new things. That's why I went for an MPH because I wanted to learn new things. That's why I got into a PhD because I wanted to learn new things. Always staying, abreast of the new developments in public health, in technology, in journal editing, you name it. So I think it's just this, will to learn and experience new things, meet new people, and exchanging with people. That's probably what drives me and of course having an impact, because we do this to have an impact on people, on community, on societies, mostly in Africa, of course. Yeah.
Wow. And that journey of wanting to learn and wanting to I guess step out of the hospital into the communities has has led you to different parts of the world, but also very major global health institutions. I wonder if you can tell us a little bit about what you've learned about global health and the way it works, and perhaps Africa's role in decision making around global health priorities, if you would.
I think this terminology, global health, isn't. Yeah, in fact, I use it very rarely because,
Mm,
frankly, I don't even know what it is.
mm,
What is global health? Is it the world of the globe, or is it the health of the globe, or is it the health of the entire world? Does it apply to rich country? Does it apply
mm,
to poor country? So I rarely use the terminology global health. And if there's anything that I've learned in public health is that you have different problems affecting different communities, and if you are in some part of the world, you'll be affected by different kind of problems, and if you are into some richer part of the world, you'll be affected by other kinds of problems. So it looks like public health is never over. But I think
mm-hmm,
the objective is to get people to live, you know, healthy life, productive life, and and to impact their society, to impact their communities. But when it comes to global health more specifically, my impression is that when we say global health, we are talking about the, you know, it has a connotation of things that are happening in those countries that are not so rich. And if
mm,
there's anything I've learned in all these arenas is that it, in one part of the world we say, okay, we have to make sure that we protect the health of our citizens, and if this means that we have to solve the problems in other places of the world that may put us at risk, let's do that. So now you have this new approach to health that is driven not because not because of altruism, like let's solve the problems of the world, but it's driven by kind of self-interest, saying that maybe we have to solve their problem because their problem may soon become our problems. And so in that framework, you have a situation where we have armies of experts coming to some part of the world and say, you know what, you should do this, you should do this. It may not be good for you, but it's good for us because if you do this, it protects us. So in that environment, you have the bottom line comes back. Those who have money are the ones dictating what should happen. So now the agenda is driven by those who have money, and those who don't have money, they follow the agenda because that's where the money is. So
mm-hmm,
is a bit cynical picture of how the world looks like, but unfortunately, that's what it is. Yeah,
mm,
but I totally enjoy my work in every single of the places where I've been. With the CDC, oh damn, I learned a lot. I learned science. I learned the highest level of science, how to do public health. I was seconded to the WHO. I learned a lot from the WHO in terms of not only technical knowledge, but also working with governments,
mm,
providing technical support, building a system. And with UNICEF, now I'm learning new brand of stuff, around, children and communities, and of course, addressing some of the, urgent issues that affects community, children, women. So I've learned a lot in all those, in all these journeys. It's a journey, indeed. Yeah.
Yeah. Uh, in your story, it always comes back to learning, and being in that position where you're able to recognize when maybe there's something that you don't know a lot about, and then you want to get to a response or a solution. And in your, like we said in your introduction, you co-founded the Pan African Medical Journal, which is a PubMed index journal, which is open access and has been in existence since 2008. And we know the role of journals in learning within a space. So we'd like to know, why exactly did you create the Pan African Medical Journal, and how did you come up to create a journal that is today PubMed Index, reputable in the continent, and open access, advancing the causes of health and public health on the continent?
Yeah, absolutely. The story of the PMJ is a very simple one. When we created the PMJ in 2008, in fact, we say we created it in 2008 because that's the year the first article was published. But the creation, the idea behind the PMJ started something like a year or 2 years or even before that. You know, things look very different. The journal landscape, looked extremely different than it was, in 2008 or in 2006. At that time you had this, division of local journals and international journals. And it was very, common to submit an article, to a journal, and they will tell you, no, this article is not suitable for an international audience. That was a response that you would get in those days. So, so we submitted few. When I moved to the US in 2002, in 2001, I don't remember, 2001 or two. So we submitted few of our articles of the work that we've done in some districts in Cameroon to some journals, and that's exactly the response that I got. No, this article is not suitable for an international audience. So that got me extremely frustrated and say, you know what, we can create a journal that is an African journal, that is an online journal, and that's open access. Let me tell you, the environment was really different. In 2008, I don't think there was a single African journal there where you could submit article online. Maybe few articles, few journals from South Africa. I don't even remember if the South African Medical Journal could already accept, online submission. Maybe. So probably few journals from South Africa. But most journals were still using the old system where you had to actually mail your manuscripts to the journal. So we decided we have to change that. We have to create a journal that is, online. And this way, around the time the open access movement was heating up really. I think Biomed Central was starting to become a big thing. So we just decided, okay, let's do that. And I just went ahead and we created the journal. And of course, we published our first article in 2008, and that was it. So it has been a long journey, and the learning comes back again. We've learned a lot, and we are still learning. We keep learning. Is a process. Yeah, that's how it started. So
Wow.
out of frustration, let me put it that way.
Well, actually, I wonder if you can expand a little bit more on that frustration. What you talked about the fact that you submitted um, research that you've done in Cameroon to an international journal, and they said it wasn't suitable for their audience, right? So the audience of your research would not, if even if it was published there, maybe they wouldn't have access because it was maybe behind a paywall, right? But can you expand a little bit more on some of the frustrations that led to Pan African Medical Journal?
Yeah, absolutely. So the submission, the article was the submission that is not adequate for an international audience was definitely one of them. So journals were, they wanted articles that were, suitable for an international audience. I don't know exactly what international audience means, but definitely not an article coming from, a remote place of Cameroon. That's the first thing. And The second thing, of course, the accessing of the articles, the paywall business, but also something that frustrated us was the fact that there were very few African journals who actually had an online presence. Very few.
Mm-hmm.
Uh, really very few. So you could search for African journals at that time online. There were very, very few. I don't even think the African Journal online platform was already up at that time. So we wanted to change that. I say, okay, man, we have to put, Africa on the open access map. Let's just add it. Let's just add a dot there. So these were all the things that motivated us to create an African journal. And we say, okay, if our article is not suitable for an international audience, there are also a lot of people in our situation, and they're probably looking for places to submit, but they just don't have those options. Right. Yeah. So that's how it is. But the situation has changed dramatically. The landscape is extremely different than what it was in 2000, 2006, 2004. Yeah.
I wonder if you can give us a picture of what the journal looks like. How many articles do you receive? How many do you publish? Where do they come from? What types of articles?
Yeah, absolutely. Now things have changed dramatically. If I show you a map of the number of submissions that the PMJ received over time, is interesting. In 2008, I think it was around June, July, towards the end of the second half of 2008, where we published our first articles. We had something like 10 articles, published in 2008, and then 2009 increases a little bit. And in 2010, so progressively, you saw the number of publications just increasing. And then we got indexed in Scopus and PubMed, and the number of articles just kept rising. And just to give you some figures, in 2017, in 2021, 2022, 2023, we received an average. If I start in 2021 to an average 5,000 articles per year. And it's probably, I think in 2021, I don't know why, we received even more. So we are talking about 4,000 or 5,000 articles on average every year. And from every single country. I think in 2022, we received manuscripts from more than 98 countries. So, so we were originally calling ourselves an Pan-African medical journals, but we receive articles from every single country. But still, the majority of articles are coming from Africa. We have big submitters such as, Nigeria, Ethiopia. Of course, Cameroon is one of the big, and of course, we have a huge following in the northern part of the continent, Morocco, Tunisia, Algeria. And we are always very happy to receive manuscript from, the remotest places in Africa, Central African Republic or Somalia or South Sudan. So, and from also far away places, compared to Africa, Nepal. We have India is picking up drastically, Indonesia, China, Russia, you name it. We receive articles from almost everywhere. Yeah. Yeah.
Right. So now you find yourself in this position of being the editor of the Pan-African Medical Journal. It's a new experience for you. So you're learning, again, like you say. So you're learning, you're meeting challenges, and you're coming up with solutions. So can you take us through some of those challenges and some of the solutions you came up with?
Yeah. Yeah, it's not easy to be a medical journal editor. I'm totally sure. It doesn't matter if you are in Africa or you are anywhere else in the world. But as African journal editor, I'm sure we face some specific challenges. And these challenges are related not only to the business of managing a journal, but also the environment in which you manage that journal. And let me first start by saying that we didn't go to a school where we learned how to become medical journal editor. So we really had to look at how it's happening, browse through every opportunities of learning, interacting during conferences or during workshops with editors of established journals, browsing through resources on the internet, and of course, just just digging into every single material that we could lay our hand on. So that's the first thing, and this is something that is missing drastically, I've noticed by interacting or we're looking at how the other African journals operate, that a lot of people don't realize that it takes a lot of learning to manage a medical journal if you want to take it to a certain level. But of course, there are some challenges linked to the environment, and one of them is the resources. How do you get the resources to operate a journal? The PMJ, with the 4,500 submission every year, is a big journal, and we have 2 offices, and we have approximately 18 full-time staff in Nairobi and Cameroon. So we had to train all these folks into the business of managing a biomedical journal. And when you have an open access journal, we charge article processing fees, and this is the primary, source of income for the journals. But when you operate in an environment where most of your authors are young researchers, they don't have money, they are self-financed.
Yep.
You have almost 50%, 70% of your authors will apply for waiver on article processing fees. So, and you cannot charge $1,000, $2,000, or $10,000 like some of the other journals. So your income is really it's not easy, because your source of income is limited. So this is one of the challenges that we have. How do we make a biomedical journal in an African context, financially viable? So you have to devise all kinds of strategies to mobilize resources. Article processing fees is not a very reliable, source of income when you have authors that don't have the means to pay. So you have to, can you partners with institutions, academic institutions, or international NGOs? So we do a lot of work advocating, mobilizing resources to NGOs, foundations. So that's how we are able to survive. But it's not easy. We didn't have a catalytic fund. We didn't have an endowment. We didn't have a massive amount of money that came in. So that's the environment we operate in now, and it's very different now. It's extremely competitive now, I have to say. Yeah.
I'm wondering then. What you would say, given these challenges of running a journal. It's not cheap. It's very expensive. What advice would you have, or what would you say to others who are looking at starting an African journal? Because there's a Pan-African medical journal, but there are also countries that can start their own local journals. But this is a challenge that will continue to arise, right? So how do we get over this hurdle, right? So that there are locally driven, locally owned journals in countries that are sustainable. Like, what would you say?
The PMJ is not we started with the Pan-African Medical Journal as the journal, but now we are kind of publishing house where we publish more than one journal. We have the PMJ, we have the PMJ One Health, we have the PMJ Clinical Medicine, we have the PMJ Conference Proceedings and the Conference Management System. So we moved from a single journal to an entire publishing house. So because we realized that you have to kind of develop not only the knowledge but also the service around publishing, and we have an aspect related to capacity building because that's one of the biggest challenges for African researchers: capacity building on writing science. This is extremely limited. We receive 4,000 manuscripts, but we reject 2/3, even more than that. So our rejection rate is massive because we just don't have time to mentor people during the journal management process. But we have our PMJ capacity building initiative where we collaborate with university to build their capacity in scientific writing and stuff like that. So when it comes to advice to institutions and groups wanting to create their journals, there is space for other African journals, but unfortunately, that space is shrinking very rapidly. And I will tell you why later. The second thing I will tell them that is extremely difficult. It's not a joke. It's not easy. It requires a lot of commitment. It requires a lot of understanding, a lot of learning of how it works to run a journal. There is something in the publishing circles that we call the syndrome of volume 1, issue 1. And most journals have gone through that. You create a journal, you have the first volume, the first issue, and you're dead because you couldn't. Yeah. And the other thing that I would tell journal editors or soon to be or want to be journal editors, think about your sustainability. How are you going to survive? So where are you going to get your fundings? Because article processing fees is not a reliable options, particularly at the beginning. So where you get to get where are you going to get your money from? Do you have a budget in your institution to support the journal, not only for 1 year or 2 years, but in the long term? So these are some of the aspects that I would suggest that they think through very carefully. And I'll ask them, do you really need to create a journal? Yeah, because sometimes, you wonder, is it the solution? Do you really need to create a journal? Maybe there's already a journal out there that's publishing what you want to publish. Maybe you can just partner with that other journal. Or you can, if your institutions really wants to publish, regularly, maybe you can go the route of the supplements that you issue every year or every 2 years with with an existing journal. Because sometimes, you just have institutions saying, oh, maybe we have to create our journals, but it's not easy. And I'm sure the failure rate for a new African journal is extremely high.
Right. And you already alluded to the shrinking space and extremely competitive nature of the medical journal space. We know, for example, that some of the more reputable journals are creating regional journals, and they're getting out of it online only journals and other products that essentially saturate the market. So what does this mean for journals like the Pan-African Medical Journal, and perhaps even for those who are looking to get into this space?
Yeah, absolutely. And it's interesting that you raised this point, William. I told you about the motivation behind the PMJ. We were told that our articles were not suitable for an international audience. This thing is gone now. Now every single paper coming from everywhere in the world is good for an international journal. So the distinction international journal, local journal is kind of disappearing. If you look at these big journals, if you look at some journals like some published by the PLOS, the Public Library of Science, or Frontier, or the Biomed Central of Elsevier, when you look at the journals that they have, you won't tell the difference between an article that is published in some of these journals and articles that are published in the PMJ. Yeah, you will see an article on let's say, the prevalence of intestinal parasite in school children in Mokolo, published in 2002. That would have been local. That would have been a provincial article, not suitable for an international audience. But today, it's good for Biomed Central Public Health. It's good for PLOS, Public Health, or it's good for Lancet Global Health. So, what does that mean? Journals are now a business run by companies, and companies, they have one thing in mind. That's normal for every single company. You want dominance, and the only way to get dominance is to go to the niches. You get closer and closer to you expand the market. You just keep expanding the market. And these big journals, these big publishers, they can do some of these things. If the PMJ does that, would be called, let's say, a predatory journal. Would be say, okay, these are predatory practices. And you see some of the behaviors are changing in the journal business. They are creating not only local, versions of their journals. It's not because they really want to help scientists in those local spaces. No, they just want to occupy that space. And I won't be surprised to see very soon that some country versions of some of these journals. I won't be surprised to see Lancet Nigeria, Lancet India, China. I think they already have some of these denominations. We'll see Lancet Ghana, Lancet South Africa. So it's just a matter of let's be there first so that we occupy we occupy the space. And so that's why I'm saying, in that context, if you're an African journal, how do you compete with, let's say, a Lancet Africa or a PLOS Global Health or like a British Medical Journal Nigeria? So they have already occupied that space, and they have the means, they have the financial muscles to occupy the space. So that's why I'm saying the space for local journals, for African journals to grow is shrinking, every single day. Unfortunately, that's the truth. And this big journal, they have this flexibility of coming up with all kinds of stuff. They will say, okay, now we are going to skip the peer review process because we want people to be able to comment on journal, even on article, even when they are published. No, it's not because they think the peer review process doesn't work. It's just because this will allow us to publish even faster and beat the competition. So these are the. So as African journal editor, we are in a situation that there are stuff that we cannot do because we call that predatory immediately. We'll be tagged as predatory, but they can do that because they are the big thing. But and my worry really is that in few years maybe we end up with the journal landscape completely dominated by a few big publishers that have completely occupied the space. You see what I mean? Yeah.
And I wonder, Raoul, what do you think that African researchers can do to combat some of this predatory practices, as you've said? Because there's I guess maybe a myth, right, that African researchers don't want to publish in quote unquote local journals, right? Which is why the Lancets and the BMJs have the upper hand, the impact factor effect, right? So I wonder what you think that African researchers, what their roles can be in elevating kind of indigenous research outlets, research houses, publications?
Yeah, I think we can blame the researchers because they are just a victim. They are just also
Mm.
victim of the system, of the academic system. And in academic institution, you'll be rewarded if you publish in let's say a journal with an impact factor than if you publish with a journal without impact
Mm-hmm.
factor. So they will tend to go towards journal
Mm-hmm.
with impact factors. So what are the journal with impact factors? These are most of the big journals, and mostly they are European journals. So the prestige that is associated with publishing in a big journal, that's important when you're in academia. It's much more important. You look like you're taken seriously in the academic business when you publish in a big American or European journal than when you publish in a local journal. So these are just the
Mm-hmm.
reality of our academic environment. There's this is the part that has to change. And uh, how does it what does it take for an African journal to be taken seriously? I think it's a vicious cycle. It's a complicated cycle. To improve your standing as a journal, you need good submissions. But you cannot attract good
Mm-hmm.
submissions if you don't have a good standing. So it's a kind of circle. It's a
Mm-hmm.
catch-22 position
Mm-hmm.
where how do you get out of this? You see. So
Mm-hmm.
if you are researchers, can you submit your hard work to a journal that is not very well known, even in Africa? So it's not easy, and I totally understand the researchers. And if you look at the PMGA, for example, when we got indexed in PubMed, it totally increases. Our submission rate just jumped. Because being in
Mm-hmm.
PubMed is seen as an indicator of seriousness. You see, when we got into
Mm-hmm.
Scopus, it jumped again, and the day we get an impact factor, it will jump even more. So, but how do you solve that? I don't know if I have the solution. But there is another way, looking at the problem. There are African journals that already have good standing, in terms of they have reputable, they have known and reputable quality. So maybe it should be possible, to not only from medical journal editors, but also for academic institutions to at least starting to look, okay, maybe a work done in Africa should be published in priority in an African journal. Or why not? And this is something that we have
Mm-hmm.
been advocating with institutions, with organization in Africa, with funders. You see, maybe that's one way to
Mm-hmm.
start, to kind of improve, support African journals. So, but not really, it's not easy. We can't put it on researchers. They're just the victim of the system.
Mm-hmm.
Yeah.
Yeah. Very, very sobering analysis of the current situation.
So sobering, that's one word for it.
No.
Yeah, it is. It is because I would think that one of the things that I've really appreciated seeing from what the Pan African Medical Journal does is leveraging the diaspora a lot. When you go on the website, you see a lot of the associate assistant editors are Africans, often that have gone to very reputable institutions. So they're helping improve that quality of submission, and also people reviewing. Obviously, it's going to take time, but it helps to know that that's what the situation is like. So, a final question will be: where do you see the future of African-led research and medical journal?
African-led research. This is something we have to work on, man. How much money do we put into research? when you look at the figures,
Mm-hmm.
the amount of money that government put into research is extremely small when they exist. But we know that the government, they have a competing priority. They have problems, and it's true that when you have problem, you can invest in research to help solve some of the problems that you have. But unfortunately,
Mm-hmm.
most of the research in Africa is totally externally driven. So when it's externally driven,
Mm-hmm.
it means people were investing in your research, to solve their problems primarily, not your problem. Uh, when we look at the
Mm-hmm.
statistics of the articles submitted in the PMJ, for example, the vast majority are just coming from self-sponsored researchers. And
Mm-hmm.
when you're
Yeah.
self-sponsors, you you don't have money to put into research. That money is coming from your family, from your uncle, mother, and that's why most of the researchers in our context, they research what they can research. They don't research what should be
Mm-hmm.
researched. You see the difference? Yeah.
Mm-hmm.
So at the end,
Mm-hmm.
you
Yeah.
end up with things that are extremely simple, because this is exactly what they could research. But if you ask me, how do we get out of that? So how do we start advocating with government to say, you know what, some of our problem can definitely benefit some research if we interrogate some of our environment, if we interrogate our system. Maybe researchers should be able to identify what the problem are and found suitable solutions. But this will only happen, of course, if we start to put money in research. Not only government,
Mm-hmm.
even the private sector. The private sector has
Yep.
huge potential to play in research, and also the donors those institution, those foundation who usually support research. And the COVID, for example, shows us that it makes sense to have research capacities not only concentrated in few places, but to have them in many places. So, but when it comes to African Journal, really, I'm just going to say once again that the space to grow is shrinking very rapidly. There are a lot of odds that are stacked against African journals. And if you look at the metrics for assessing the quality of the journals, they're extremely difficult to meet by African editors.
Mm-hmm.
I think we had the opportunity to interact with other editors, through groups, through meetings, through conferences, and by learning a lot. And so we're able to to learn a lot and learn how to adopt some of these to meet some of these requirements. And let's say, for example, a journal will be taken seriously if they have, let's say, something like the DOI. Uh, uh, DOI, yeah,
Mm-hmm.
if they have some most of these tools that have nothing to do with the article itself, but just give the impression
Yeah.
these guys they're serious. No, do they
Mm-hmm.
have doublons? Okay. Do they have a DOI? Okay. But these technologies, they're becoming more and more accessible. But to master them, you need to build some
Mm-hmm.
local capacities in biomedical publishing. But there are very few institutions. I don't know if there is an institution in Africa training people to become biomedical journal editors. So if you couple those
Yeah.
challenges linked to the environment, to fundings, and then to the shrinking space, to the competition of established publishers, and also to all the biases that are coming, from the rest of the world, because African journal, when you look at them, yeah, they primary seen as, oh, they are predatory, oh, they are probably not serious. or they are probably they're producing, research of, the low quality. So when you have all these biases added there, it's a
Right.
complicated situation. So my worry is that the colonial house, that's how I call it, the colonial economy, where you just, produce
Mm.
the raw material and the final product is produced somewhere else, may end up persisting, where we have African research that is published in journals elsewhere. Because even the PMG as a journal, I don't think we are out of the wood yet. It's a delicate balance of surviving. How do we keep surviving without? You don't want to crush the researchers, the young researchers in particular, but you still have to, to keep, maintaining the standard at a certain level. So it's how I see the future of African publishing. It will be tough. Some journal will be there, of course. In South Africa, they have journals, for more than 100 years now. I was surprised to see that some African journals are more than 100 years old, and there are few. So they are there, but the space for new journals to emerge and thrive. That's what I'm worried about, and truly.
Well, I mean, it's very sobering, but I actually also lots of hope.
Yeah.
Because just from what you're saying, you said you just start small. When you started, co-founded the Pan African Medical Journal, right? There was the space was very much different from what it is now. But from what you're saying, it seems like there's a lot of progress. There are new challenges that have emerged, obviously. But again, we need to start small, like you say, to address these problems and learn from the journals that are 100 years old, like you're talking about, that have made it this far. So I take that as a positive note, but we have to continue working, coming up with innovative ways of running our journals that don't necessarily mirror the rest of the world or the Western world ways of working with our researchers to do that. So with that, Dr. Raoul, thank you very much. We've enjoyed having you on the show. It's
Yeah.
Thank you guys for that. It was an interesting conversation. It was really a pleasure to discuss with you guys. Thanks for what you're doing. It's really interesting.
Thank you.
Thank you. Yeah. Just closing out, we want to remind everyone that this special episode was brought to you by the Promoting Decolonization Using Innovative Knowledge Practices grant, which is hosted by the Center for Tropical Medicine and Global Health of Oxford University's Nuffield Department of Medicine. And today we had our first guest, Dr. Raoul Kamadjeu, who will be sharing links to his various contacts and to the Pan African Medical Journal with this podcast. And you can reach out to him or to the journal to further the conversation. Thank you all.